I've been at Heartland for 10 years, and we have just steadily grown as far as the need for staff in all of our different programs. I think that the increase in need is kind of twofold. I think one is that we've had a pandemic. We have social media in people's lives that can kind of bring really good things, but also create some more complexities for people as far as their mental health. But the other part of that is just increased awareness, and that's one of Heartland's main missions, is to increase awareness in the community and end the stigma. And so, if places like Heartland and like agencies in our area are doing that, are working hard to erase stigma, increase awareness, let people know that we're out there, then there's just going to be more people that are seeking the help. And so I think those kind of two factors have contributed to the need for more staff, and for us to expand. I mean, we've run out of room here. We have people working from home, we have people sharing offices, so it's time for us to move somewhere bigger.
Okay.
We're able to get people in fairly quickly. We have walk-ins. We have a walk-in clinic Monday through Thursday, so typically there's not going to be a wait for mental health services. We also have different wraparound programs, one being our crisis line. So if someone's in crisis, they can get help immediately. So we've been able to push through some of the barriers of the workforce, but I will say, because of the amount that the need has expanded so quickly, I think it's going to take some time for the workforce to catch up, for sure.
Okay.
Research shows us what groups are maybe more at risk, or what factors cause people to be more at risk. Certainly if someone is dealing with a major mental illness like major depression or bipolar disorder, symptoms of that illness may contribute to their risk level for suicide. We know that hopelessness is one of the highest risk factors in regards to, that's a symptom of major depression. If people are not having any hope that things are going to get better, that puts them at high risk for suicide. I think another risk factor are the groups that still really have a lot of that stigma or haven't broke through that. And so we all go through really tough things in life. We all have, stressors that we're dealing with. The people that know they can reach out and get help, obviously that really decreases their risk, for a suicide attempt or to die by suicide.
According to our data analysis, we found that the greatest number of deaths in our 21 county region was among white non-Hispanic males 45 to 54, followed by white non-Hispanic males aged 25 to 34. So they're accounting for roughly 81% of the suicide deaths in the region over that 22-year period, 1999 to 2020.
Mm-hmm.
I'm wondering, why do you think that is? Is it just, they made up more of the population, or they're...
I think that certainly could be a factor, but I think there's two things to consider with that. One is that when you're speaking of males in general, we know that they tend to turn to more lethal means of suicide. So I say that because their death by suicide may be higher proportionately to attempts, if that makes sense.
Okay, sure.
The other factor is just kind of what I spoke about, that white males are going to be more at risk, that they're not going to seek help, that they're going to feel like they need to just deal with it on their own. Especially when you're talking about our region, like if you're talking about rural areas and kind of just that mentality of, pull up your bootstraps and deal with it and get through it. And we don't, seeking help makes you weak or whatever types of beliefs that a person might have that would prevent them from reaching out. I think if we're talking about people looking for warning signs just for their loved ones or people in their lives, changes in behavior, and I know that's a general way to say it, but you know your loved one, kind of what's typical or normal for them. And so if there's a sudden change in behavior, that could look like increased irritability, that could look like changes in eating, changes in sleeping, changes in how they interact with people. So, they have tended to be a pretty social person, and all of a sudden they're isolating or withdrawing. So any significant changes in behavior patterns, I think, are warning signs. Obviously, if a person's showing depression symptoms, anxiety symptoms, another warning sign is somebody making some indirect statements like, if I didn't wake up tomorrow, what would that matter? We talk about direct suicidal statements and we talk about indirect suicidal statements, and sometimes the indirect ones are more likely to be missed. I think if you notice some signs in a loved one, if they're willing, if they're saying, yes, please help me, then reaching out to any medical professional or any mental health professional is a good start. So that could be getting them to their primary care doctor, and they're going to have them do their series of screenings, and that's going to trigger maybe some mental health care. Or bring them to a place like Heartland, whether it's Heartland, Siouxland Mental Health, any of the agencies around town, to get them in for an assessment. But I do want to note that sometimes people are in such a bad state of mind that it's not that simple, so to speak, to just say, let's go to an appointment. So if that's the case, they could reach out to a crisis line like Heartland's, and loved ones don't always know what to do, and some of that is because they're too close to it. And so just to reach out and say, this is what's going on, and I don't know the next step, can you please help me? And that's when a mental health professional can step in and help.